Hello, RDs and RDs to be. Welcome to the RD Exam Ready podcast. I'm Zach Caseberg, your tutor, your coach, your guide along the path to passing the RD exam. My biggest passion is to help RDs and RDs to be just like you to know how to effectively pass the CDR exam. If that sounds like you, then hey, you are in the right place. If you're looking for more free content, make sure that you're checking out all of our content that we're doing on Instagram, TikTok, YouTube. All of those handles are RD Exam Ready if you need to find them. A reminder that we're doing periodic live sessions on YouTube. The most recent ones have been on intro, total parental nutrition, food safety, and general practice questions. If you can't find those, make sure you go to the live tab on YouTube, rewatch them back completely for free if you can't join us during the live session. And I wanted to mention that I am due for one this week if you're listening live, but we won't be able to hold a live session this upcoming Wednesday. I'm going to be doing some solo parenting this week, so there's just no way to fit it in. But keep a lookout for our next one once we're going to have some more availability for that. If you like those sessions and want to get the PDF notes after the session, make sure that you join the mailing list that is in the bio of this podcast to get more free content that way. Now, one thing I know you're going to get on the exam is questions about life cycle and questions about different populations. Life cycle nutrition is a huge part of being an RD as we need to understand the feeding patterns of all demographic groups. We've done a previous episode about infant nutrition. In that episode, we discussed the ways to interpret anthropometric data for infants, feeding patterns, vitamin, mineral, and macronutrient requirements. I'd like to do the same today, applying to toddlers and kind of that preschool age children. We'll be approaching it much the same way that we did infancy, but we'll get the chance to elaborate on some more unique topics for children in pediatrics. A toddler is considered 1 to 3 years old. Once a toddler reaches the age of 2 years old, the growth chart measurements that we use will change. If you remember in infancy, we were using the WHO, the World Health Organization recommendations of weight for age, length for age, weight for length to measure where a child's anthropometrics are compared to other children of the same age and the same sex. Once they reach the age of 2 to 20 years old, we shift over to the CDC guidelines. The charts that we use for a 2 to 20-year-old would be some of these following measurements: weight for age, stature for age, which was length for age when it was just a baby that we needed to measure lying down, but because it's a toddler or a preschool age child, they can stand up usually. So we use stature for age, same thing as saying height for age, head circumference for age, weight for stature, and BMI for age would all be used for those CDC growth charts that we're going to follow. Now, we're going to use these measurements to track growth for the toddler and child and see what percentile that they're in. The child in the 50th percentile for these measurements is right smack dab in the middle and average compared to their peers. For the exam, we just need to be acutely aware that there is some BMI breakdowns for overweight to obesity for a toddler or a child. Make note of these. For children 2 years of older, a BMI for age in the 85th up to the 94th percentile would indicate overweight, and a child with a BMI for age at the 95th percentile or above would be obese. Let's repeat that one more time. So basically, it's 85th to the 94th percentile, that's going to be overweight, and a 95th percentile or above is obese. So if the child is in the 94.5 percentile, they're considered overweight. If they're in the 95th percentile or above, they're considered obese. Make sure you know those differences. During the phase of toddler and early childhood, we're seeing changes in these kiddos all over, specifically in their physiological and cognitive development. Keep in mind at this point, toddlers have mostly been on breast milk or formula for the majority of the nutrition that they require. And maybe we're starting to see introduction of some solid foods, but for the most part, breast milk and formula is making up the most of the nutrition that they need, like I said. Between a year and a half, that toddler should be able to move their tongue from side to side, maybe start making some circular patterns, and start learning how to chew foods and chomp those soft table foods. Additionally, right around that year, their ability to use that pincer grasp to pick up items, to pick up things, is going to be improved. so they can pick up fine little motor things like cooked peas, cooked carrots, put them up to their mouth, and learn how to feed themselves. Hey, they might even be able to start using a spoon or a utensil, just probably not very well. Largely, they can eat with their hands during this phase as they kind of explore their eating patterns as they go through. Even though this toddler is developing their own motor skills, they're getting their own independence too. I want to do it. I can do it. I don't want others to help me. That's the kind of statements that we see there. Keeping in mind, we still have to keep a safety element in mind, so adults are always monitoring the eating process. And we're trying a lot of new foods, different sizes, different foods, and the potential for choking hazards also starts to increase right around this age. Now, let's discuss appetite introduction of foods to toddlers. A good rule of thumb that you can keep in mind is 1 tablespoon of food per year of age. So, a serving for a 2 year old child would be about 2 tablespoons of food if we were to measure the volume there. Keep in mind that their growth is slowing during this time compared to when they were a baby. So, their growth was really increasing as a baby, and now it's starting to plateau a bit. So it's very normal to see decreases in food and appetite interest during this time. Some parents think it's just a food jag that they're having, but a lot of the times the child is just figuring out their own appetite and what types of foods that they like. You should be familiar on exam day for what choking hazards would be for a toddler. Now, those would be things like hard candy, popcorn, nuts, whole grapes, hot dogs, marshmallows, large pieces of raw apple, celery. These would all be things that are likely and potential choking hazards for that kiddo there. When they get up to that preschool age, they're much more able to use things like forks, spoons, and a cup on their own. They may not be able to fully use a knife to spread something for themselves effectively, but at this point, their pincher grasp and ability to lift food to their mouth should be nice and refined, and they should be able to feed themselves there. The choking hazards still do exist, but you just have to make some small modifications. You can cut grapes in half lengthwise, cut hot dogs into quarters or small pieces, or just cut them long ways. And always having an adult to supervise them will just help to prevent any risk of choking for this child. At that childhood phase, once they're kind of in that preschool, we see greater ability to introduce new foods and shape this child's food preferences. Children like to eat foods that are familiar to them, and they do tend to reject foods initially, but learn to accept them on repeated exposure. It may take 8 to 10 exposures to a new food before a child will accept that new food. Keep that 8 to 10 in your head as maybe that's a potential exam question, but all in all, we just need to understand that it takes usual reintroduction of a food before it actually is something the child likes to eat. I think a lot of parents just don't get to that point. Energy and nutrient needs for toddlers and preschool age children will be our next topic. There is a formula used to calculate the calories needed for young children. However, it's pretty extensive and you're not going to need to know it for the exam day. But I want to give you some form of a reference. A 4-year old boy who weighs about 35 pounds and who is, let's say, either sedentary to highly active, they would require maybe 1,200, maybe even 1,600 kcals per day, which is just so much to me. Note that, as I said, that's specific to the child's activity level, depending on how active they're going to be. But yeah, it's a lot of calories. For protein, it's a little easier. For a 1 to a 3-year old, the RDA for protein would be 1.1 grams per kilogram per day. We'd see even maybe even a slight decrease to 0.95 milligrams per day when they get older. And that's because you know that their level of growth is starting to level off a little bit because their need of protein is also leveling off at the same time. So you're seeing a similar decrease as their growth is decreasing. For vitamins and minerals, we have three key nutrients that I want you to focus on here off the bat. That would be iron, zinc, and calcium. Now let's talk about iron a little bit of why we're going to have the recommendations we do. We would recommend 7 milligrams per day of iron for a 1 to 3-year old and 10 milligrams per day for a 4 to 6-year old. The reason that iron is so important is, of course, during this phase, we're trying to prevent any anemia from occurring. We know that iron is such an integral part of hemoglobin, the ability to transport oxygen in the blood, So, in order to prevent that anemia, we need these children to meet those high iron needs, hence why there's so many iron fortified children foods. Related to iron, before we move on to those other vitamins and minerals, I wanted to mention about CDC recommendations for the prevention of iron deficiency in children. To help prevent iron deficiency, the CDC recommends that children 1 to 5-year old don't drink any more than 24 ounces of cow's milk, goat's milk, or soy milk each day. Now, I don't think you need to remember the 24-ounce number, but remember what it's saying. It's saying that, hey, make sure these kids don't drink too much milk, and you need to know why. The reason why is because cow's milk and those foods we mentioned don't have a lot of iron in them. So if the child is filling up on milk all the time, they're not going to be getting sufficient amount of iron because those foods just don't contain enough iron. So they're at a higher risk of anemia right there. We don't want them filling up on these beverages because they're just not high in iron and they're going to be a lot higher risk for anemia for sure. Next was zinc. The mineral zinc is always known for helping cell differentiation, growth, and development. So it makes sense as to why it's so important for little kiddos, especially. The DRI for zinc is going to be 8 to 11 milligrams per day, is what we're going to have down there. And then going on to iron a little bit. Okay, so we talked about iron. Let's talk calcium just a little more. Why do you think that these kiddos require calcium, RD, to be? Think through it. Well, mostly because of how much they're developing during this phase, right? We know that their bones are growing a lot during this phase, so they do require a good amount of calcium during the day. We recommend 700 milligrams per day for a 1 to 3-year old and 1,000 milligrams per day for a 4 to an 8-year old. So let's review those nutrient needs one more time. The DRI for iron is about 7 to 10 milligrams per day, which is pretty close to that of a normal, healthy adult male, if you think about that, just to give you a close reference. The DRI for zinc, as I want to kind of reiterate here, I think I said it wrong before. A 1 to 3-year old would require 3 milligrams per day of zinc, and a 4 to 8-year old would require 5 milligrams per day for zinc. Now, an adult themselves requires between 8 and 11 milligrams per day. So, this is all to say that the zinc requirements for a child is lower than that of an adult. So, just make sure you understand. Once again, it's going to be about 3 to 5 milligrams per day for a child for zinc. Calcium in adults is 1,000 milligrams to 1,200 milligrams per day. And that feels very close to that of what a child requires, about 700 to 1,000 milligrams per day. So you can keep that reference in your mind to say, okay, well, their calcium needs for a child is pretty close to that of what a normal, healthy adult would be. Let's talk fluoride a little bit. We've talked about fluoride in infancy a bit. Let's touch on it here. Fluoride is necessary for children at this age, preferably to get it from fluorinated water. And we know that fluoride is very helpful for the prevention of dental caries and just help for that teeth development here. So, if water supply is not adequately fluorinated, a fluoride supplement is recommended. Children aged 6 months to 3 years need 25 milligrams of fluoride per day. If the water they're drinking does not supply enough, then keep in your back pocket this number that we would just want them to have 0.25 milligrams of fluoride per day is what we would need for there. So 0.25 milligrams of fluoride per day would be enough to meet their needs to help with developing those teeth and prevention of dental caries if they're not getting it from the water itself. A young child does require fiber in their diet as long as they are, of course, on solid foods. This is mostly to help prevent heart disease, blood lipids, cancer, diabetes, hypertension, as well as help with childhood constipation. The adequate intake for fiber for children is 19 milligrams per day. That's what we need to focus on right there. I don't think you're going to get a question about it, but just know, yeah, they need a pretty good amount of fiber too. It has been discussed before in the American Academy of Pediatrics of what their recommendation is for vitamin D. So we know that in infants, it was a recommendation of 400 IUs per day of vitamin D. However, at this toddler preschool age, we see that jump up. And it's recommended to consume 600 IUs per day of vitamin D for a toddler, all the way up to adolescence, whereas in infancy it was 400. So we saw a little jump to that point. Now let's apply what we've learned today on these practice questions. Number one, overweight is defined as A, weight for age percentile, 85th percentile to 95th percentile. B, weight for age percentile greater than or equal to the 95th percentile. C, BMI for age percentile, 85th percentile to the 94th percentile. Or D, BMI for age percentile greater than or equal to the 95th percentile. A lot of percentiles in there. Read that again. Number one, overweight is defined as A, weight for age percentile 85th to 95th. B, weight for age percentile greater than or equal to the 95th. C, BMI for age percentile 85th to the 94th. Or D, BMI for age percentile greater than or equal to the 95th percentile. I'm going to use process of elimination A, B, C, and D to see which answers are bad and which ones I like. Starting with A and B, both of those say weight for age percentile for overweight. Now, what I've kind of learned in this topic today is that we're not really using that weight for age percentile to tell if a child is overweight. We talked about it being much more focused on BMI for age. And so, right off the bat, what I would recommend is get rid of A and B because we're not using those as the diagnostic criteria for diagnosing someone with overweight or obesity for these kiddos. So now I'm on to C and D. C was the BMI for age being at greater than the 85th percentile up to the 94th percentile. And D was the BMI for age percentile greater than to equal to the 95th. Answer D, I feel I would need to rule out because the greater than or equal to the 95th percentile is not going to be overweight, rather, it's going to be obese, as we found. So I'm going to rule out answer D, leaving me with a C. Overweight is defined as a BMI for age greater than the 85th percentile up to that 94th percentile, and that will be our best answer for number one there. Number two, a safe snack option for a toddler would include A, raw apple slices with peanut butter, B, thin deli turkey with thin cheese, C, whole grapes and popcorn, or D, marshmallows and pretzels. A safe snack option for a toddler would include which of these? For A, raw apple slices with peanut butter. What I worry about the apple slices is they can be just so big and they're not very soft items. So it's going to be difficult for one, a child to chew that, and two, it might just be too large that it'll obstruct their airway. So to me, I would rule out answer A. I don't think that's a safe snack option for a toddler yet, maybe when they're older. B, thin deli turkey with thin cheese. I think this would be a safe snack option. Of course, there's always the risk for foodborne illness, but we worry about that much more with pregnant people and not so much the toddler, right? So with B, I think that would be a pretty good answer, and I'm going to hold on to that. C, whole grapes and popcorn. Right off the bat, I know those two are going to be big choking hazards, so I would rule that one out off of our list. It's not going to be a good safe option for the toddler. Or D, marshmallows and pretzels. Well, whole marshmallows, especially, are going to possibly obstruct the airway. Pretzels could do the same there too, just because they're large, hard, and can't be chewed easily. So I would rule out answer D. I don't think that's a good fit. So to me, for number two, a safe snack option for a toddler would include answer B, thin deli turkey with thin cheese. Number three, per the American Academy of Pediatrics, a child that's 3 years old should consume blank IUs of vitamin D per day. Number three, per the American Academy of Pediatrics, a 3-year-old child should consume blank IUs of vitamin D per day. A, 200 IUs, B, 400, C, 600, or D, 1200 IUs. So, what did we just learn about this when it came to vitamin D? We learned that infancy would require 400 IUs of vitamin D per day. But once they're going into that early childhood, we saw a little jump there. So A 200, that would be much too low. We know that's not a number that sticks out to us, so I would rule that one out. B 400 IUs is a good answer. However, that's what we would use for an infant and not for a child who's 3 years old. So I'm going to rule that one out. C was 600 IUs. This fits very well with what I learned today. That's saying that 600 IUs would be the recommendation once that child is in that early childhood, kind of up to adolescence area. Indeed, 1200 IUs per day. This feels like a little bit of a question mark or just too high. So to me, I would say C. Per the American Academy of Pediatrics, a 3-year-old child should consume 600 IUs of vitamin D per day. That wraps up today's lesson, students. I hope you listened, learned, and enjoyed today's show. Remember that passing the exam is a journey. We all need assistance along the way. Do me a favor, hit the subscribe button. If you haven't, tell the other studying students. Rate, review, help spread the word. And remember, as always, happy studying to you, RD to be.